Hi, and thank you for your interest in learning more about Sedera's medical cost-sharing community. We all know that the healthcare system is complicated and expensive. The Sedera medical cost-sharing community was launched to bring relief to thousands of businesses, families, and individuals across America for that very reason. Our vision is to make human, transparent, and affordable solutions the new normal in healthcare. Sedera is not insurance. Instead, our model is built on the proven 30-year legacy of the healthcare sharing ministries and the innovation of our modern sharing economy. So here's how it works. Medical cost sharing is an arrangement where a member voluntarily contributes to the medical needs of a larger community on a monthly basis. Then, when that member has a medical need, the community in turn shares with them as well. This concept has been around for years, almost exclusively offered by ministries to specific faith communities. Sedera draws from the wisdom and experience of this model, but makes medical cost sharing available to everyone. Informed, engaged healthcare consumers are essential for our model to work, and we view our relationship with our members as a partnership. To maintain a healthy, affordable community, our members commit to being involved participants in their healthcare by building healthy lifestyles, understanding their true medical costs, and driving their own healthcare decisions. This unique combination of personal responsibility and care for others is not only empowering, but is also economically rewarding. Sedera's medical cost-sharing method is structured to promote individual ownership and direct access to care, and we understand the value of the patient-doctor relationship. That's why there's no provider network and no in-network, out-of-network concerns. You have freedom of choice when it comes to the doctors you visit, and the patient-doctor transaction stays simple, without any third-party payers. Members submit reasonable monthly membership contributions and know what their costs will be when a larger unexpected medical expense occurs. With Sedera, you're a cash pay patient, but you are never alone. Our concierge-style approach offers you direct access to resources and information. We leverage innovative technologies like telemedicine and virtual expert second opinion services, while providing good old-fashioned people-to-people customer service. When you do have a larger medical need, our cost-sharing model allows us to negotiate fair prices for your medical costs. Say, for example, you fell and broke your leg while out jogging and had to be transported to the hospital in an ambulance. There, they took a few x-rays and sent you home with crutches, pain medications, and orders for rehab, along with some follow-up appointments. All of the costs associated with the incident of breaking your leg, from the ambulance ride through the final rehab and then the follow-up appointments, are considered a part of that same medical need. We define a need as all of the medical expenses caused by a single accident or illness that exceeds your selected initial unshareable amount. The initial unshareable amount, or IUA, is the amount you pay before the community begins to share in your medical expenses. Your IUA might be $500 or $1,500 or another number. This is something you choose when you join Sedera, and then the amount you contribute monthly is determined by the IUA you have chosen. Whether a need lasts 1 day or 3 years, you are simply responsible for the IUA amount for that need. All eligible costs that exceed your IUA for that need can be submitted to the community for sharing. The only time Sedera asks a member to pay the IUA again for the same need is if it has been more than 12 months without symptoms or treatment. So let's take a look at another real-life example and compare a family's costs with Sedera versus a traditional health insurance model. In this scenario, we have a family who needs to address their child's persistent ear infections. Let's say they have a traditional insurance plan with a $5,000 deductible per family member. The child needs a series of antibiotics and injections and ends up at an ENT specialist who puts tubes in both of the child's ears. On the left in purple, you can see the traditional insurance model. Their total out-of-pocket expenses for the office visits to get the antibiotics and injections, plus the specialist visit and surgery, come to just over $2,500. On the right, in green, you can see that the cash pay patient with Sedera would have only paid their $500 IUA. The office visits, prescriptions, and injections would be paid for directly by the member. The specialist visit and the surgery cost would have been shared with Sedera's medical cost-sharing community because the member had already paid their IUA amount of $500 on this need. When it was all said and done, being a Sedera community member would save this family $2,000 in out-of-pocket costs. So let's say this happened in October, and then in February of the following year, the tubes in the child's ears fell out. Under the traditional insurance model, the deductible would have been reset, and the family would incur a little under $2,200 in costs to repeat the specialist visit and the surgery. With Sedera's medical cost-sharing model, the repeat specialist visit and surgery would have been considered part of the same need. Those additional costs would be fully shared with the community because the family had already paid their IUA for this need. Sedera's member services wrap around you, providing a multitude of ways to get access to the care you need. Our member services team is there to coach you on how to ask doctors for cash pay friendly rates. Also with Sedera, you have unlimited 24/7 access to board certified physicians through a telemedicine service. Doctors can visit with you over the phone or by video chat and can even prescribe medications. If you find yourself with a new diagnosis, a chronic condition, or in a position where a provider wants to change your treatment plan, you can use our second opinion service that we offer. Specialists from around the country are available to review your case and issue non-biased second opinions. You should know that for any non-emergency surgical procedures, you are actually required to use the second opinion service for that need to be fully shareable. So let's talk about pre-existing conditions. A condition is considered pre-existing not only if you've been diagnosed, but also if you've had symptoms or treatment within the last 36 months. Pre-existing conditions become eligible for sharing based on how long you are a member of the Sedera community. In our graduated sharing schedule, expenses related to the pre-existing condition are not shareable within the first 12 months of membership. In months 13 through 24, they increase, and in months 25 through 36, they increase again. On month 37, any need related to this pre-existing condition is now fully shareable. Due to the increased likelihood of higher medical costs associated with tobacco use, households with one or more tobacco user are required to contribute an additional $75 a month. Unless tobacco users age 50 and older are confirmed tobacco-free for 12 months, they will have a sharing limit of $25,000 for each of the following conditions: cancer, heart conditions, COPD, and strokes. When you need help navigating the world of medical cost sharing, a member advisor is just a phone call away. They can help research fair market prices in your area, as well as help you find a provider or facility for your medical care. If you feel ready to join the Sedera medical cost sharing community today, we invite you to complete your registration. Once you do, you will receive a welcome email that includes your welcome packet and other helpful information. Be sure to click the link in that email to schedule a welcome call with a member services advisor so that you can feel ready and excited to be a part of the Sedera community. We also host monthly webinars for our members so you can continue to learn about Sedera and get the most out of your membership. Thank you for your time. We look forward to partnering with you to create a new normal in healthcare.